So the story is about this woman, Florence Nightingale, who in the UK is worshipped. She's worshipped a little bit like the Virgin Mary. So how did she get to be such a revered figure? What did she do? And the answer for why she's revered is, well, she was a great nurse. During the Crimean War of 1854, 1855, she went out to Istanbul and she was responsible for nursing care in one of the hospitals in the Scutari region of Istanbul. And I think Nightingale doesn't get enough credit for the way she treated data. So how do you square the woman who drew this amazing picture with her insistence that the statistics should be dry? I think it comes back to something that we've heard over and over again today: the importance of trust. And sure, you can create a powerful message, you can draw a pretty picture, but ultimately, the underlying statistics need to be trustworthy. What does that mean? What does it mean to be trustworthy? Well, first of all, the statistics have got to be accurate. So although Nightingale's graph was very cleverly presented, all the statistics were very clear, all the numbers were absolutely correct. Anybody could go and plot their own graph or do their own analysis. It was all there. And she wrote to Farr. She said, oh, we will be attacked and they'll fire their guns, but they will not shake our foundations. Get the basics right. Do your clever graphics later. Get the basics right. But another, I think, important part of trustworthiness is that people need to see how the data are being used. So Baroness Honora O'Neill, the philosopher, has been thinking about this a lot. And she says if you're making decisions and you want those decisions to be trustworthy, well, the basis of the decisions has got to be accessible, accessible, usable, and understandable. So what does that mean? Accessible means like people can get at the basis of the decision, maybe the data or the data set, or they have some kind of access to what's going on. Usable means they can actually use it for something useful. They don't have some meaningless, confusing jumble of data. They actually have answers to their questions. And it's understandable. They can understand what is going on. And also, because the world is a complex place, they need to know that people they trust, people who are experts, are able to assess the data. So accessible data means not just, oh, I've got access to the data, but people I trust can survey that data, can attest that data. She did important work in standardization. William Farr, her collaborator, his big thing was standardization. It was all about all of these reports coming out of all of these hospitals all over the British Empire. No one's using the same definitions. Doesn't make any sense. It's not useful. So they were absolutely insistent on standardizing the data. I mean, this is one of the things Florence Nightingale did, was to go to these international conventions on data standardization. It's a far cry from being the lady with a lamp. She's the lady with the data standards. But as we know, those data standards are absolutely essential. And then there's the question of putting the data into a form that people can actually people can collaborate on. And when it comes to medical data, that's not so straightforward, as we all know. Medical data is incredibly sensitive. You can't just create a data set and maybe strip some names off, call it anonymized, we know it's not anonymized, and then put it out into the world. That won't do. And so that's why I've been delighted to hear all the talk today about trusted research environments. So Florence Nightingale would have dreamed of trusted research environments. The idea that you can create a space where the data are completely safe, but people from all over the world, if they've got the right credentials, can ask questions of that data. The queries can be shared. The queries can be checked. There's a tremendous platform for collaboration while protecting the privacy of the patients at the heart of that exercise. So while you can crunch the numbers all you like, and draw the graphs and argue over all of these things. Nightingale always put the patient first. Remember where the story starts. The story doesn't start with a data table or a spreadsheet. Florence Nightingale wrote personally to every family of every dead soldier. For her, it was all about the patient, all about the welfare of the patient. And if you can't remember that, if you can't put the patient front of mind, then what's the point of all the data? Florence Nightingale used data to make the world a better place for her patients. We have access to information, to analytical resources, to computers, and all kinds of technology for sharing data that she could only have dreamed of. I hope that we live up to her legacy.